To the Health and Wellbeing Board for November the 9th. Could I please remind you to bring your microphones very close to you so that people that have got the loop system on can hear very well. So if you can do that, please. I noticed there's a number of people that are joining us online. So I hope the technology works. And again, we need the microphones and to speak this clearly and this close to them for people online so that they can hear. The emergency exit is through the door that you came in and follow, I'm sure one of us, and we all know where we're going down the stairs, we can't use the lift. So, and the emergency exit's out the front there. Okay, so I've had apologies for absence, which is Michelle Legg, Terry Norton, Darren Cattell, Laura Gordian, Emma Carina and Chris Ashman. Are there any other apologies that anyone knows of? Councillor Andre?
Yes, Chair, thank you. Can I just highlight that Councillor Emily Brothers is substituting for Councillor Shirley Smart as the IWOC representative today. And I'm sure that we would all like to send our best wishes to Councillor Smart, who is not in good health at the moment.
Okay, thank you very much and welcome, Emily, and thank you for coming to join our meeting. And yes, we do send heartfelt warm wishes to Councillor Shirley Smart. So the substitutes, as we have just said, we've got Mike Ballpit for Emma, we've got Emily Brothers for Shirley, and we've got Mark Howe for Laura. So those are our substitutes for today. So we have got the first item on the agenda, which is we've just done apologies and changes in membership. There's no other changes or anything else? No? Okay. So the next item is number 2 on the agenda, which is to confirm as a true record.
Sorry, Chair, I think Councillor Brothers wishes to speak.
Councillor Brothers.
Thank you for the introduction, Chair. Not just as a blind person who doesn't know who isn't able to see who is in the room, but also I think for anybody who is new or perhaps in the public gallery not aware, it would be quite helpful if we went around just briefly introduced ourselves, because it would certainly tell me as a disabled person who is in the room that I don't know.
Okay, well, there's no one in the public gallery. If I go from me first, so I'm Laura Peace Wilcox, I'm leader of the council and the chair of this committee.
Wendy Pereira, I'm the interim chief executive at the Isle of Wight Council.
Simon Bryant, director of public health.
From Wight, strategic lead for partnerships for the Hampshire and Isle of Wight ICB.
Caroline Morrison, Chief Strategy and Transformation Officer for Hampshire and Isle of Wight ICB.
Michaela Dyer, Managing Director for the Isle of Wight part of the ICB.
Ian Lloyd, Strategic Manager for Partnership and Support Services.
Mike Ballpit, Chief Exec of Local Charity Community Action Isle of Wight, here on behalf of the Voluntary Sector Forum.
Jill Kennett, representing Health Watch.
Mark Howe, Assistant Director for Adult Social Care and Housing Needs.
Amanda Gregory, Strategic Manager for Regulatory and Community Safety Services, here on behalf of Colin Rowland, Director of Neighbourhoods.
Sarah Phillips-Bourne, Democratic Services Officer.
And Councillor Debbie Andre, Cabinet Member for Children's Services, Education and Lifelong Skills.
Isle of Wight Association for Local Councils.
And if people online would like to introduce themselves, please.
Morning, shall I go first? I'm looking at the list alphabetically. So it's Steve Crocker, I'm Director of Children's Services.
Hi there, I'm Sue Cochrane, Consultant in Public Health with the lead for Adult Mental Health and Suicide Prevention.
I'll come in now if I may. Good morning, Derek Benson, the Independent Chair of the Isle of Wight Safeguarding Children's Partnership.
Good morning all, I'm Mohammed Jawad. I'm a consultant in public health with the lead for domestic violence and violence reduction.
Morning everyone, I'm Juliet Pearce. I'm Director of Nursing, Midwifery and AHPs at the Isle of Wight NHS Trust.
Right, I think that's everyone online. I'm just waiting for a few people that that have been held up that have just arrived. So once they've taken their coats off, if we can have your introductions, that'd be lovely. Thanks very much. We did realise that a couple of people would be late due to boats and services, but we're very appreciative they're turning up. So Rachel.
Rachel McKernan, CEO of Age UK Isle of Wight.
Morning, James Stewart, Director of Operations for Mental Health at the Trust, here for Leslie Stevens.
Morning, Alex Charge. I'm the Acting Superintendent, so responsible for all policing on the Isle of Wight. We would have been here on time, we've been waiting in reception.
That I apologise for that, sorry, thank you. Okay, so we move on to item number 2, which is to confirm as a true record the minutes of the meeting held on the 28th of July. Is there anyone that could propose that those are a true record, please? Whoever was here. Yep, Simon and Michaela, thank you. Oh, I went listening, but I just I'm gonna take me forever that one. Run my pen. Okay, so we move on to item number 3 on the agenda, which is declarations of interest. Are there any declarations of interest, please, today? No declarations of interest. Okay, we move on to item number 4 on the agenda, which is public question time. We've received no public questions, and there are no public in the gallery. Chairman's update. I thought there was an update I was going to do. No, there's not. I don't know. So Chairman's update, following the health and wellbeing strategy and the health and care plan having been signed off at the last health and wellbeing board, a joint launch is being planned. That's, is there anything else, Simon, on that?
Working closely with partners across the system to bring that together so that we can have an aligned joint launch in the next couple of weeks, working with the Isle of Wight Trust and with the Isle of Wight ICB.
Thank you very much. So we move on to item number 6 on the agenda, which is the pharmaceutical needs, which is you, Simon. Thank you.
Many thanks, Chair. So this paper is to present the Isle of Wight pharmaceutical needs assessment prior to publication. Every health and wellbeing board has a legal responsibility to publish the pharmaceutical needs assessment, looking at pharmaceutical services and whether they meet the future and current needs of the population. It's really prescriptive in the regulations about what this is about, and this is about where services are rather than opening hours and provision of services within. So we undertook the needs assessment. We went out to consultation, and you can see in the paper we've had some responses which mainly can support that provision. We are very aware that the pharmaceutical needs of services is kind of not as straightforward as just a kind of technical provision of a shop front, and we've been working closely with the ICB colleagues on some particular issues. Pharmacy is not immune to the issue of recruitment and retention. So whilst the document is set out and it meets the requirements and is correct, there are obviously some nuances, and we're working very closely with partners to make sure that we continue to meet the needs of the Isle of Wight population with regard to pharmacy provision.
Are there any questions for Simon on this report? No? Okay. I would just say it's a shame the way it is very technically written for technical people. I got quite a few people in COWS to complete the form, mainly because of their concerns, and I was quite pleased that actually they were second highest in the respondees, so I did a good job there. But you know, I think the main crux of it, it's just a bit sad that it's not about what the public's biggest concerns are. But there we go. That's what it is. What it is. Thank you.
Chair, I agree, and I think there's something Michaela and I work very closely together. It's actually how do we take this forward and meet the needs of our island population with regard to actually the services required. And I do agree, the prescriptive nature from NHS England doesn't make it an easy process, but that's the legal duty we have as a board. But I kind of apologise, but we want to work forward on that.
Michaela?
Yeah, I'd echo what Simon said, and I agree the technicality of it is a requirement but doesn't make it easy. I recognise that the main concerns in people's minds are actually about accessibility to a pharmacy and issues we've got with pharmacies that are closed predominantly due to the ability to recruit pharmacists. And so the work we're doing is very much with the large, in the main, the large companies that provide most of those pharmacies on the island to try and keep pharmacies open, particularly in those places where we know we've had recent closures. And you know, Ventnor, I'm sure some of you are cited on the capacity constraints we've got there. So whilst this is a technical document, the work is really focused on the operational, keeping things going. And I should note, we did meet in an informal briefing with the Health Scrutiny Committee yesterday and talk through these issues alongside dentistry in some detail.
That's very good. Councillor Andre?
Thank you, Chair. I may have missed it, but I can't see, and it may not come within the remit of this study, but a lot of residents have been directed in recent times to Pharmacy First. And obviously there is an implication there with the available. Does the Pharmacy First service come within this, or is that something that stands outside of this?
So online pharmacy, you're right, it's back to that technical nature of the document. So we have to look at where pharmacies are based physically on the island, including if there's an online kind of, not even an offer, but where their head office is. But actually, obviously, if you're online, you can access that anywhere. I think what we need to work, and that's kind of, I think what Michaela's saying, online is great for some people, but it's not for everybody. And you don't get that interaction and that pharmacy conversation. So that's the kind of conversation we need to move forward rather than being, unfortunately, stuck on the technical document, which we have to do. And so I think maybe a conversation for next time, how we just really move this forward in a more collaborative way.
Can I just have a follow-up on that, please? Just briefly. I am aware that certainly in my particular area, there was a recent incident where staff were actually subjected, there was actual flooding, so it was circumstances beyond their control. And I think it's quite disappointing in a way that there wasn't more engagement, and I think that's something for us all to take away for future. But I think probably outside of this, some work needs to be done in that collaboration and a better understanding between the public and the pharmacists and the service that they provide, because obviously that kind of behaviour actually inhibits the service rather than enables it and promotes it.
Yeah, that's noted. Thank you. And let's hope that we can move forward on this, because it would be quite nice that we can, you know, through either the Health and Wellbeing Board, the Scrutiny Board, or something that we can actually make this better, because that's what we need for our residents. Okay, so Simon, did you want to come in?
I think that's really helpful. I think what we need to do next time is do the technical document, admit that's what it is, and then work with partners a little bit earlier. I think COVID just delayed us to say, actually, what else do we want to learn about pharmacies, and do kind of two things together to make sure we meet our duties, but also understand and collaborate together.
That's lovely. It's way forward. Thank you. So we move on to item number 7 on the agenda, which is the Better Care Fund. I think that's Ian Lloyd is leading on that one, and it's just for noting. But if you can just talk us through, thank you.
Thank you, Chair. And just in terms of this, I will take the papers being read because I don't want to get into the technicalities unless otherwise asked to. But I think it's important to note that there was a paper that was brought to this board back in July. The proposals were for the completion of the narratives and submissions that needed to go back, and there's an outline of the timeline that was required to be completed. Unfortunately, the national timeline doesn't tie in with our Health and Wellbeing Board, so hence why some adjustments had to be made to fulfil the asks nationally for the submission, but to avoid that automatic trigger if we didn't submit the required BCF returns. So with that, in July, there was authority provided, delegated authority provided to my colleague to the right of me, Michaela, and also to Laura Godian to aid the completion and the return within that timeline. This report obviously just gives a background in terms of what the submission is, how the submission supports the island in terms of its flow, its integration of services and provision to the tune of 51 million, and that's highlighted in paragraph 15. The report clarifies the approach in terms of the narrative that was submitted in the areas that we are refreshing, we're reviewing, and equally, it's fair to say that the Section 75 legal agreement we have is a very complex and large document. But as part of this review, the ongoing work will be now to revise that Section 75 in light of the submission that we've submitted and the various schemes that are going to be undertaken. One thing to highlight in terms of the risks under paragraph 27, point B is positive in relation to that we've had some feedback already from the National Assurance Team who indicates that we have passed the initial stage. So they're satisfied with what's being submitted and our approach to the use of the BCF funds. And that will now go through the national sign-off process and hopefully that will flow through. So in essence, Chair, the paper is to update the Health and Wellbeing Board in terms of what was submitted on their behalf through the delegated authority for our 22-23 Better Care Fund, and equally to note that that will now be incorporated within the Section 75 agreement to reflect the changes that have been submitted. So I was going to leave it at that, if that's okay.
I think you've got to be congratulated on the way that we're going through for the recommendation for approval. That's no mean feat. So it's very good to know that that's happening. Are there any questions for Ian on the paper? Wendy?
It's not a question on the paper directly, but it is a question about our approach moving forward with the Better Care Fund, because I think we get caught out every year by the timing nationally and health and wellbeing boards. So why can't we be a bit smarter and foresee that and manage health and wellbeing boards in the diaries so that the content for discussion in terms of what is within the Better Care Fund and how we are going to use it does actually happen at the Health and Wellbeing Board as opposed to being delegated to others. That's my first comment in terms of moving forward. And the reason I bring that up is because I would like us to challenge how the Better Care Fund is being used, particularly given the context that we're working in and the sorts of pressures that we're seeing on health and care services generally. And I think we need to be asking ourselves what we can do about making better use collectively of the Better Care Fund and our respective agencies' funding to deal with wider health and care issues in the community, really kind of valuing the community support that we can give to our residents. And it feels to me, and I apologise if this sounds derogatory, it's not meant to, but it feels to me like we are at a point in time where we need to rethink our approach on that as opposed to carry forward our approach from previous years. I just think it's next time round, we're at a point in time where we do need to think differently about this.
I'll bring in Michaela first and then I'm sure Ian will want to come back. Thank you.
So you'll be delighted to know that Wendy and I are in violent agreement on this one. And what I would say is we need to move away, and Ian and I talked about this already, we need to move away from thinking about it as an annual process that has got arbitrary cut-off points. And as good commissioners collectively, we should be all the time reviewing the use of the Better Care Fund and the fact this really focuses your attention on the fact we're spending £50 million in a pooled way. I just wanted to draw people's attention to the top of page 47. And that lists out there the 7 areas in which the Better Care Fund is focused on. And as Wendy has indicated and Ian has indicated, they are some of the most critical things that we are spending money on collectively as a system at the moment. And they are the areas where we have the greatest pressure. So there is absolute commitment And, you know, like it or not, things are going to feel even tougher next year. Some of the hospital discharge funding, which is referred to in this document, that was given as a result of COVID, you know, will be stopped nationally, and therefore we are going to have a really tough time. So we have to do a really, really effective review of the effectiveness of all of those bits of spending. So absolutely yes, and that work is already underway. It's not something that we'll need to start. It has already started.
Ian, did you have any comment? Thank you.
I think it's been summarised really well by Michaela. So it is an ongoing piece of work, and absolutely get what Wendy is referring to in terms of the timeline. Some of it is based on when the national guidelines are released. We didn't receive the national guidelines until the 19th of July, so partway through the year until we've got the information. But this, as Michaela said, this is about ongoing commissioning. We're in control of what the needs are for our island population. It's about what we do to address those challenges, and work is continuous.
Thank you. Are there any other comments on that plan? No? Okay, well, it is just for noting, so thank you very much, and thank you to the team for the hard work. And it looks like it's a team. We'll do better for next time. So thank you. I'm going to move on now to item number 8 on the agenda, which is the Isle of Wight Safeguarding Children's Partnership. Is Steve, are you leading on this one?
Is that, if I just do 30 seconds and then I'll hand over to Derek. So what this report is, obviously the council has a number of safeguarding functions around child protection and so forth, but this particular report talks about the partnership and how all partnerships, all partners fulfill their safeguarding duties. So this is not purely a council focused report. This is a partnership report, at which I'll hand over to Derek Benson, who is the chair of the independent chair of that partnership. Over to you, Derek.
Chair Steve, thank you. Can somebody just confirm, can you hear me okay? Lovely, thank you. Chair, if with your blessing, I didn't propose to go through all 47 pages of the report, and you've also got a very, very comprehensive cover note, which hopefully colleagues have had the opportunity to digest at their leisure. As Steve has said, this is a report about the whole partnership. It covers the year April 21 to March 22, and we're asking the Health and Wellbeing Board today to note the safeguarding and wellbeing of children on the island remains at the forefront of the work of the partnership, and there is an ongoing, and I hope there always will be, a commitment to protect children, and that's demonstrated ably across the partnership. The last couple of years, as everybody knows, presented unique challenges, and I think it's fair to say that the partnership on the island responded robustly to those challenges. You will see in the annual, the yearly report there, the structure of the board, how it's financed, how it's set up, our subgroups. I don't propose to go through those, but should anybody have any questions, be happy to take them. It details the business plan, which is separated into 2 parts: long-term strategic objectives and shorter-term goals, in-year objectives, if you will. It lays out the principles that run through all that we do. We try and, as best we can, understand the voice and lived experience of children, young people and their families. There is an ongoing phrase that's very much part of the safeguarding community, that safeguarding is everyone's business. It is, absolutely, but there will always need to be those practitioners, those professionals who are driving it forward. Responsibility often falls upon the shoulders of a few, and those few, that's not fair. The many on the island who are engaged in safeguarding, as I say, do a job. We aim to be a learning partnership, reviews, audits, and the like. And our role is to ensure that safeguarding is of the right quality as it possibly can be. And as I say, I think the report details just that. It goes through the priorities one by one around safeguarding adolescents, responding to neglect, protecting children from sexual abuse, and some short-term objectives there around the ICON programme about keeping young babies safe, around every sleep counts, similar, about keeping babies and young children safe there. The Lurking Trolls campaign, which is around online threats and risks to our young people. We had a priority around improving dissemination and communication. And I have to say that Jane Lee, the manager on the island who recently retired, did an absolutely fantastic job over all the years I've been working on the island. And I wish her well in her retirement. And Jane must take the credit for producing, as she does year in, year out, an excellent yearly report. And the last priority mentioned in the summary sheet there around effective safeguarding of unborn and newborn babies. All of this done against the background, as I say, in the last year of an emergence from COVID. It hasn't gone away, as we know. And as you would expect, conversations at the moment, and I know this is a report to the end of March, is around the unique challenges we're likely to face this winter: cost of living crisis, fuel poverty and the like. So I mentioned that to say that the partnership is an agile one. We have the benefit of and I believe Councillor Andre is in the room, a really engaged lead member for which the partnership is very appreciative. That isn't the case everywhere that I work. So Councillor Andre, a huge thank you as I'm about to exit stage left from the partnership for your commitment and your engagement. It is much appreciated. Colleagues will note there were no CSPRs for the year we're talking about, but there will always be careful consideration of any matters brought to the partnership for our attention. You will also see in there a detailed breakdown of the audits we did, the Section 11 audit, which is across the partnership, and the education audit. Chair, I wasn't proposing to say anything else. I'm happy to take any questions, and back to you.
Thank you very much, Derek. Can I? I've just been told that you'll be leaving your role by the new year. So can I thank you on behalf of the island people for everything that you've done, for the help and the support that you've given. It's incredible, and just really grateful, really, for everything that you've done for island people. Thank you so much. Are there any questions for Derek? Debbie?
Not just not a question really, but I really do feel I need to respond. Thank you, Chair, for highlighting Derek's fantastic work as independent chair, and he will be sorely missed. One of my main focuses, one of the administration's main focuses, is the voice of the child. And it's so good when reading through this report to see how evident the voice of the child is. And I'd really like to thank Derek, especially at the IOWSCP conference, that he actually co-compared with our Island Youth MP. And that was, it just really brought everything to the fore about safeguarding children and what it's really about. So thank you, Derek. Thank you for all your fabulous work. And we will continue with that and ensure that that our children are kept safe and their voice is very much heard. So thank you.
Right, I can see Steve's got his hand up.
Just to further endorse that and to further embarrass Derek, Derek's been a great chair for us for a long period of time, but there comes a point when you've been here so long you're no longer independent, and we've reached that point. So Derek's also, and just to reassure people, is helping to settle in the new independent chair, who is a chap called Scott McKechnie, and he'll pick up that there should be a seamless join as we go forward, and Scott again is very familiar with all of these issues. So just to endorse what Councillor Andre said, and to pass my thanks on to Derek, who's been an excellent leader in this space for us. Thank you.
Thank you very much. I mean, there were some sobering statistics in there, which, you know, for somebody like me that doesn't deal with this all the time, I know a lot of you do deal with these things. It was quite sobering. I was on the telephone to my sister, and we were just absolutely blown away by some of the information in here, and alarmed, I think, actually in places. But thank you, Derek, sincerely. I do hope that there is a seamless link over with Scott. And you know what? Really enjoy your retirement if you can, and you're not dragged into doing something else voluntary, as is always the case. So thank you very much. Are there any other questions in the room about this report? No, well then, thank you so much again, Derek, sincerely, for the many years service that you've given, and yeah, very much appreciative. So without further ado, turn back to my other bit of paper. So next we've got on the agenda the mental health update.
Thank you. Simon, are you going to say a few words first and then do you want me to follow?
Right, so as part of our health and wellbeing strategy, we have part of that's around mental health and wellbeing. And it's great we've got Sue Cochrane and James here, who are really going to take us through a very brief presentation on the update of what the work we are doing in mental health. I'm not quite sure starting, so I'll hand over to both of you.
Thank you, it's me. And hopefully you can see a slide now. So please shout if you can't. We've just got two slides. It's a verbal update and a brief one. Thank you. And a double act between myself online and James Seward in the room. And so thank you for giving us the time to update around mental wellbeing. Following and during the kind of aftermath of the COVID pandemic, there's been a lot of focused work on the island around mental wellbeing that we just wanted to make sure that you were all cited on, both across that prevention and early intervention space led by the public health team on the island and by James's team within the NHS. So we're doing a double act today. And the work around mental wellbeing and suicide prevention is actually led by the Mental Health and Suicide Prevention Partnership. And we have recognised that there is a huge amount of work happening on the island around mental wellbeing that needs coordinating. So we're currently working alongside the LGA sector-led improvement programme to really gather all of the work happening on the island around adult mental wellbeing into a 5-year plan to begin to coordinate some of the work and ensure that it really does reach the island residents and that we see an improvement in mental wellbeing outcomes within that prevention and early intervention space. So like I say, that work is being led by the Mental Health and Suicide Prevention Partnership, and we have a really strong network of community organisations that sit underneath that in the Mental Health Alliance, coordinating work around mental wellbeing, and I'll cover some of the work that Alliance is running through this presentation, then pass on to James afterwards. So we have some focused work happening that's been happening over the last 2 years and that we're committed to carrying on for the next 2 years around training and upskilling people in mental wellbeing and suicide prevention through the delivery of the mental health first aid training and specific training around debt and anxiety, recognising the impact of the cost of living, but that actually being in debt really does align to also poorer mental wellbeing, and we need to have conversations with people as a whole to make sure that their mental wellbeing is really at the forefront of the work that we're doing. So like I say, we have a commitment to deliver that across the next 2 years on the island. And then within this space, we've also been doing a lot of work around coordinated communications and signposting, specifically around World Suicide Prevention Day and World Mental Health Day, making sure that the communications campaigns that do go out are really focused on reducing stigma and ensuring that people know where to go for help. And around World Suicide Prevention Day, there was a single campaign across Hampshire and Isle of Wight ICS around the life card that you can see on this slide, with a specific kind of tagline attached to that around, do you know where to go for help? So really ensuring that not only do we open conversations around mental health and wellbeing, but we also make sure that people can access and move on to that help if they need it. Within public health, we've also been leading alongside the Mental Wellbeing Champion, the Mental Wellbeing Small Grants Fund, of which we provided seed funding for 17 small community organisations over the last year, and we'll be launching the next round of that funding very shortly. And that is around focused work to ensure that we support those who we know have a disproportionate likelihood of poorer mental wellbeing outcomes, so thinking about those health inequalities that arise, and last year some of those organisations working with families, with children and young people, and with veterans across the island to make sure that within our communities that support is available for local people. And I just wanted to highlight that the island has been part of the large amount of national investment that we've had across Hampshire and the Isle of Wight ICS around suicide prevention, which has seen some real gains in this space, both in terms of the work that I've highlighted around upskilling frontline workers, but also making sure that, for example, people who are bereaved by suicide have open, free access to ongoing support, because we know that the likelihood of suicide is increased amongst those who are actually affected by suspected suicides themselves. So it's a busy space, and we recognise that, through ensuring that we're collecting all of this work into this single aligned strategy, which we'll launch next year. And I'm very happy to come back and talk more about that once it's launched. So James, I believe your slide's next. I'll hand over to you.
Thanks, Sue. So from the NHS side, I suppose the context in terms of alignment with the work that Sue set out is that we are in the penultimate year of dedicated mental health investment standard funding. Much of that is dedicated towards kind of improvements around children and young people services, which I was asked to focus on around crisis services and some of the older people and dementia related services that I'll touch on in the next couple of minutes. Around children and young people, I'm pleased to say that we've attracted some additional funding around a new service which is focused on 16 to 25-year-olds, which is the difficult group as people move through from being supported by children's services into adult services, which we've historically been not very good at within the NHS, and making sure that we've got better transitional support in those areas. And we're looking at a really exciting project where we're focusing on peer support leadership, which is not just coming from the Trust, but it's a partnership with IOWSCP, the Wellbeing Service, and the Youth Trust to be able to develop that work moving forward. We're also continuing to roll out the mental health support teams in schools, which is a national initiative to provide access and support to students with the leadership team within schools to have access to CBT low intensity support and onward referral to kind of services if required. We're now in 26 schools and colleges across the island, 16 primaries and 2 sixth form colleges, the Isle of Wight College, and 7 secondaries. Not fully rolled out, but getting closer to integrating that moving forward. Turning to the Trust services, there's been a big investment or increase in capacity, which sadly is not yet meeting the stepped increase in demand around CAM services, particularly around surges in eating disorders issues that we have on the island. But we now have got stepped up permanently a dedicated psychiatric liaison service that's embedded in the emergency department. Traditionally just been an adult-based service. We now have CAMS support workers that are there as well, so that we can intercept and assess people that might be children, young people that come into the emergency department, and try and avoid admission if appropriate, but make sure that they get the support that they need moving forward. As I say, we've also expanded the eating disorder service, and somehow, I'm not quite sure how we've done that, but thanks to Michaela's team, we seem to have got the lion's share, or a slightly large amount of the Hampshire and Isle of Wight money around that. But I think we've got particular issues around eating disorders in the island, although it is a regional and national issue on that one moving forward. We've also got some funding around the closer to home service, which is essentially a virtual ward or community-based home treatment service. So we've got a caseload, which means that people don't have to come into beds. We're trying to avoid children and young people being admitted. They get that kind of virtual support in the community more. And there's some interesting pilots that are happening with some of our mainland partners, particularly at Southampton General, which we hope to replicate on the island moving forward. So that's the focus on children and young people services. There are many other things in that space as well, but I just wanted to touch on working age adult services. Lots of work in terms of improving crisis response, which is to try and pick up people in a crisis more quickly in the community. We've piloted this year a joint initiative called the Rapid Response Vehicle for Mental Health, which is with the ambulance service, where we have 3 days a week, we have a paramedic and a mental health nurse that are stationed in a vehicle, which can be deployed through 111 into the community, either to people's homes or a point of incident, the idea is that we can try and respond both to people's physical and mental health needs and see if we can avoid that person needing to come to the emergency department at all or to be admitted moving forward. Early indications are that we're going to get expanded funding to go 7/7 for that service from April, such has been the success of that programme in this year. And of course, the reason why there's a lot of focus on crisis is there is no doubt that the acuity and the volume of people that need inpatient admission into the adults services there. We continue to have about 120% occupancy rates in 7 acres at the moment. 120%, how do you do that? It's because we have people that are on leave at some stages, but basically we have all of those beds that are full at any given time moving forward. So we need to do more in terms of making sure that we've got community alternatives to admission moving forward. We've got the right partnerships with the mainland as well if people do need mainland bed supports, which we try and avoid. We've done really well with consuming our own smoke in terms of inpatient admission on the island. On older people services, largely around the focus around dementia, connected to the dementia strategy moving forward. One of the things that we've been focused on with Commissioner support is access to dementia diagnosis through the memory services has not been good enough on the island, has been exacerbated by the backlog caused by COVID when people weren't coming forward and being referred. And at one stage we had about 500 people that were on the waiting list with waits of nearly a year to be access to diagnosis. That service was traditionally a consultant-led, consultant-delivered service. We've completely remodeled that service, and we've now got a substantive new consultant that's coming in to lead that service in January. But it's going to be a much more nurse-led and multidisciplinary team service, which means that we're got a recovery plan trajectory to significantly bring that waiting list down in the next few months and try to get more rapid access to. So that's a really important part of the dementia strategy moving forward. The other area that we focused on is the dementia outreach team, which works across the community, works with care homes, with people that are, it's post-diagnostic support for people that are diagnosed with dementia. It currently is a 5/7 or 5 days a week service. We've just gone out and expanded that into a 7 days a week service. And increasingly, there's a pull into supporting the medical wards where people tend to get admitted, but they've got coexisting memory loss issues. And our liaison service can help to move them forward, and help flow around acute. But the biggest success of the dementia outreach team is that we've now reduced to 1 the amount of the people that are on the mainland, because we do not have dementia beds on the island. And the reason why that person can't be repatriated is to do with social care packages. I'll talk to you about that later, Mark. But they've been fantastically successful, and I think that we are stepping towards that service providing more intensive support on the island. Has been fantastically successful as part of the strategy moving forward. So that was a whirlwind tour between the life course in terms of what we're doing around mental health services. There are many challenges. I think the memory service remains there, but we are making good progress on all those. And we've really got to make sure we use that last year of funding to get where we need to be with these services before we have to kind of enter what is a more challenging financial environment with the rest of the health and care system. Thank you.
Thank you. Are there any questions? Or anyone? Oh, I'll come into Amanda and then Councillor Andre.
Apologies, Sue. I might have missed it. The strategy is due to be launched in 23. Is it a draft strategy at the moment, or has it been approved and can be circulated?
It's being written as we speak, and it's being written by the Mental Health and Suicide Prevention Partnership. So it's a partnership written strategy that's yet to be finalised.
Okay, that's brilliant. Will it come to the Health and Wellbeing Board?
Yes, I'm happy to bring it.
Okay, so Councillor Andre and then Wendy's chomping at the bit.
I give way to Wendy if she, no, okay, all right. I may be comparing apples and pears here, but we heard earlier on this meeting about the Better Care Fund, and I know that there are a lot of constraints on that, but we also heard about collaborative working, and we've just heard of some quite sort of pinch points and areas where I think that review potentially of the application of funding from the Better Care Fund could have an impact in these areas. is that something that could happen moving on? Because it strikes me that one sort of leads into the other.
All right, Michaela's going to pick that one up.
Yes, absolutely. So as per the conversation we had around the Better Care Fund, a lot of the dementia funding is pooled within the Better Care Fund. So it's part of that review to say, are we getting absolute best value? And as you probably heard from James, I'm fighting really hard to make sure that we get at least our fair share, quite often more than our fair share, which we haven't always in the past on the island. So that's really critical in terms of maximising spend in that area.
Can I just have one more point, just to highlight that some mental health first aid courses were actually offered to elected members. And I did one of those courses with Kate Golding, who is absolutely brilliant, and I would thoroughly recommend that. And I also did a Suicide Light first aid course, so I would thoroughly recommend. And those are available to elected members. I'm not sure if there, I presume there might be availability outside of that, but they were extremely beneficial courses. Thank you.
Wendy and then Simon.
Just quickly, a couple of things for me. We had a really good presentation at the Island Health and Care Board in relation to the mental health services and improvements in the services recently. But one of the issues that were picked up by the GPs that were in attendance, excuse me, it's a shame that Michelle's here, is that there was some more work to do on being clear about referral pathways and who refers to where and how referral happens. So I think as a health and wellbeing board, it would be useful for us to seek assurance that those issues are being covered in terms of how the services are being delivered, because that referral pathway working smoothly and effectively delivers services to the people who need to use it more effectively and smoothly. So I think that's an issue that we need to be aware of. And Sue, you mentioned that the partnership were, as we speak, writing the strategy. I wonder if you could outline what the opportunity for co-production from those people who are accessing services have in being part of writing that strategy, please.
Of course, thank you. So we set up a task and finish group to write the strategy, and that task and finish group consists of a number of members, one of whom is specifically looking at some of that co-production piece. And we've also been co-producing alongside the Mental Health Alliance, which I've already said has representation from 40 different organisations. So it's been quite a process in terms of that co-production piece. We're in the writing stage now, but earlier in the year, we sent out surveys. We've been working with Councillor Lilly around some of his listening tour to ensure that the findings that he has collected through his work with Healthwatch in addition is also fed into that strategy. And like I say, the task and finish group has a number of kind of representatives from across the community the community of the island, to ensure that it is not just a single document written by public health, but actually it's a partnership document written by many people.
And I concur with what Wendy said. Thank you for that. So about the referral pathways, if a GP doesn't know the referral pathway, we're in a pretty bad state for the public, you know, let alone them trying to navigate. So I think those referral pathways is very important. Simon?
It's really helpful conversation. I think there's something that, and I think what's brilliant here, we're working together. I think sometimes in the world of mental health and well-being, the language gets confused. So James quite rightly is focusing on the services for people who are mentally ill. And then what we're trying to do is have a wraparound about mental well-being. Wendy's quite right to highlight many people have experience of poor mental well-being. Indeed, all of us have good and bad days. I'm thinking, looking at Rachel across the room, you know, older people in terms of the group. No. I used to work, sorry, older people are a group that we need to think about in terms of mental health and well-being. So how do we engage in the whole population to improve their mental health whilst we also improve our services and referral pathways? Sorry, Rachel.
Oh yeah, carry on.
Sorry, can I come back on the referral pathways issue? So in terms of primary care referrals, specifically for services, Wendy, I'm not sure if that's specifically around access to memory or dementia services in general. So on On the memory service specifically, then I indicated we've got a complete new model of care, and we've agreed a revised care pathway, which we've developed in co-produced that with GPs. It's about to be launched, and we're thinking about what the best way to get it out there is. I think Michaela, you and Michelle kind of used the Ireland group, and we'll probably come back to that to advertise that, and we can share that here. More generally with primary care, there's quite a lot of investments going in through the No Wrong Door to actually blend the pathways together around what we do with our community services, what they have in terms of increased support that they've got available in primary care. And they're looking at how we can make sure that there's sort of trusted assessor route, so you don't have to be reassessed when you come into services through those services. There's a lot of change around that as well at the moment. So not perfect yet, but a lot of work, good work going on in terms of that interface at the moment.
Thank you. Okay, so if there's nothing more on that one, thank you all very much for everything you're doing. It is really much appreciated. We know that we're in a bit of a black hole with mental health, you know, aided and abetted by COVID. So we move on to item number 10, which is the integrated care strategy. This is just an update. Who's doing that?
Yes,
Caroline.
Thank you very much, Chair. So yes, I've come with Fran today from the Integrated Care Board to talk a little bit about the update of the development of the Integrated Care Partnership interim strategy. And hopefully what you might see as we go through sort of the process of some of the emerging themes is that a lot of what we've talked about this morning broadly in terms of integration feeds into all of the work we're doing. So I'm sure colleagues know that it feels like we're on a journey to integration across health and care. And probably what I'd say, obviously sort of being relatively new into this role and coming from a borough-based role last time, was that I think integration has been quite successfully developed and evolved in local partnerships where people have had health and wellbeing board plans, joint strategic needs analysis. But what we haven't necessarily done is leverage that and look at that across a broader geographic footprint. And with the development of integrated care systems now, we've got a chance really to have a bit of a think about how we amplify some of that partnership working that has been taking place at place. Think about how we utilise the impact of a broader range of partnerships that geography might allow us to do. And also think about how we share learning across us. So this isn't a brand new thing. This is about an evolution and part of how we're developing the way that we develop our resources, our skills and expertise across organisations, really for the benefit of our population. So you'll see in the paper, there's something really that sets out the four broad aims of integrated care systems around improving outcomes of population health and healthcare, tackling inequalities and in outcomes and in experience and access, supporting broader social and economic development, and enhancing productivity and value for money. And again, I know those are things that people have been working towards collectively for a long time, but this is our chance really to leverage some of that. So one of the things that we have to develop as part of an integrated care system is an interim integrated care partnership strategy, which we are looking at doing by the end of December. And I think it's really key here to say that it is interim. The ambition and the breadth of thinking that is coming through from all of the partnership and working and the engagement so far has been phenomenal, but this is about a journey. So tackling some of the really tough issues that we have around prevention, promotion of healthy lifestyles is going to be a long-term piece of work. So all of this continues to evolve, but we do have something that we will have in place and developed by the end of December that sets the direction, has been engaged with a range of people and starts to set out what that looks like for us across Hampshire and the Isle of Wight. There's another piece of the sort of the jigsaw puzzle, which is an integrated care board joint forward plan, and that's a little bit more of the sort of formal NHS technical plan type submission around operating plans, and really starts to kind of crystallise what the ambition and the strategy looks like into what that reality means with regards to delivery. So they are two different things, but they are absolutely linked and move from ambition into the reality and operational delivery of that. So we've started to pull through some emerging areas of focus, and I'll talk a little bit about the process that we've done that. As I said, we're not starting from scratch, so we are absolutely working from existing joint strategic needs analysis. We've had some fantastic support and input from our directors of public health who have worked with us on the JSNAs both in the local patches, but then also looking across Hampshire and Isle of Wight and seeing what some of the themes are that we might want to draw through from that, so that all of this is really focused on population need. We've been collating some of the perspectives of partners, so the team have done a lot of work. There's always more to do, but we've started and done a lot of work going out and having conversations with partner organisations, stakeholders, to really find out what's top of people's minds and what we really think the focus and the priority should be if we're going to set the ambition that we should for the patch in Hampshire and Isle of Wight. And that's led to the identification of 5 themes for us to look at. So children and young people, mental well-being, prevention of ill health and promotion of healthy lifestyles, workforce, and digital and data. Those are the 5 things that people think, actually, if we do this together, we set some really clear priorities, we can shift some of the real challenge around this and unlock some of our potential. We also ran an event on the 28th of September, which hopefully a number of people here were invited to, and I think a number of people did join, to have a look at some of the evidence, and then that helped us distill a bit more of a long list, which is a bit further down. But as I say, this is all part of an ongoing process. It doesn't stop with the submission of a strategy in December. It really sets the tone for how we want to work going forward, so it is part of a journey. So in terms of just thinking through, I won't go through sort of all of the themes in detail, but I think what we are really cognizant of is we could try and solve everything in a strategy around this, because we do want to be ambitious. But the challenge for us is that this is part of a journey. So what we need to be thinking through is, what are some of the specifics, what are some key areas of focus that we think will have an impact for our residents and patients, but will also give us some meaningful progress in a period of time, so that we build some momentum and we build some success together. And you'll see we've started to think around some sort of cross-cutting themes, so things like the first 1,000 days, how can we work together to think about how we really give children and young people born in Hampshire and Isle of Wight the best possible start to life. Some work around the transition, so I know that came up in one of our previous presentations, so great that everyone is really focused on some of those key areas. Reducing social isolation and loneliness. We think, you know, there's a lot that we could do, and there's a lot of work happening in particularly with VCSE colleagues that we probably could leverage and think about how we expand and do that differently. So really honing down to the what that we could do together to get us going, deliver some momentum and build some success. So just in terms of next steps, we will continue to build on those themes, articulate what we think the impact of some of our areas of focus might be. We might not choose to do everything in one go. I think we need to think through phasing. So what might we choose to do first, and what might we think that we could then sort of develop further going forwards once we've really built that really good platform of partnership delivery, and continuing to work with colleagues such as the Health and Wellbeing Board in Isle of Wight and partnerships, but also our other places, Southampton, Portsmouth, Hampshire, so that we're building on what's happening in those local systems rather than duplicating or cutting across everything, because the integrated care partnership and the integrated care system really is an enabler for developing and building all of those joint priorities, joint delivery mechanisms, and then looking at where we can add value above and beyond those local partnerships. So I'll stop there as a bit of a summary, but happy to take any questions.
Okay, so are there any questions? Thank you very much, Caroline. I do think those 5 priorities are actually pretty bang on. It encompasses pretty much everything. And in actual fact, when I read the wording to it, the little bit of quotes, I thought, gosh, is that me speaking? Was that my actual quote? Because it literally did replicate what I was thinking, and I think it's quite good. I think it encompasses just about everything in that simple way. Simon.
I just wanted to inform the board. So after the formal Health and Wellbeing Board this morning, we've got an opportunity to have an informed discussion on the strategy so that we can actually give more input from the Isle of Wight perspective. I've been working very closely with the team to make sure that our issues are represented clearly, but I think we need to do some more work about how we localise that going forward.
Mike.
Yeah, Mike Bulpit from Voluntary Sector Forum. I mean, I was chatting with Fran as we were walking up the stairs around how successful the board's being and in terms of working alongside voluntary sector colleagues, etc. And obviously, there's a potential resource issue in terms of helping Action Hampshire sort of navigate the support process for it all across the Solent area. I guess I just need to stress the point again that without some resourcing for the facilitation of the voluntary and community sector, you are going to struggle to achieve the levels of engagement that you wish to see, because you won't get around to doing it on your own because you're too busy doing other things. So support voluntary sector infrastructure bodies to do that job for you, but that just does need some resourcing.
Can I just say, to add to that, without our voluntary sector on the Isle of Wight would fail in every way. Our voluntary sector are absolutely keeping us going. They are seriously so important to us on the island. So Mike is right about making sure that we have that connection and that they've got their support. Really important. Okay, there's no other questions on that, although I am rather strategied out. Just, you know, I could walk to the moon on back on strategies. Okay, so we move on to item number 11 on the agenda, if there's no further questions. So members' question time, there are no members' questions. So we can now move on to item number 12, which is the Health and Wellbeing Forward Plan. So to discuss any, oh wow, gee, more strategies probably. To discuss any new items to be added to Health and Wellbeing Forward Plan. Are there any, Simon?
So I think from my perspective, we've had a really good update on the mental health aspect of the new strategy we've got. So we'll carry on working through those themes. I think also, Chair, we discussed last time actually having a shorter board like we've got this morning and a chance for discussion. So I'd welcome input from colleagues about issues that would be relevant. And it may be some of the issues raised this morning, such as loneliness. Let's have a deep discussion, but in a workshop session going forward. So I'd welcome that.
Thank you very much. So without further ado, this part of the meeting ends. Councillor Andre, it doesn't end.
Apologies, Chair. This may well be a peripheral item that should go to policy and scrutiny for health, but I have to highlight through personal recent experience that there is a real issue with car parking at the hospital at the moment. Is that something that the board would pick up, or is that something that would go to policy and scrutiny?
You could take it to policy and scrutiny, but really it's actually for St Mary's to sort.
Okay, I'll handle that outside of this then.
Oh, Juliet's online somewhere, so that's for Juliet to pick up. Do you want to just quickly, Deb, say what the issue is?
Yes, it's just that there's literally one machine working and the queues of people waiting to pay, and often in quite stressful circumstances. I think that is, I know it's only a minor point, but it is causing some distress to people.
Juliet, did you want to come in?
Yes, thank you. Thank you for raising it. It's something we're aware of and has been highlighted and discussed at our board. We are coming up with an improvement plan, which I can get you an update from Joe Smith, our Chief Operating Officer, who's responsible for this part of the facility. I know that we're looking at improved machines, cover for those machines in the wet weather, the number of machines that are available. So it's certainly on our radar, and I believe that there is an action plan for improvement. So I can get Joe to share that with you if that's helpful.
Thank you, I appreciate that.
Okay, thank you very much. So we move now to ending this part of the meeting. Our next part is going to be about the health and wellbeing strategy and